Welcome to DIYPRP, NeutroFree PRP Advanced PRP Preparation with Neutrophil Reduction. In this video, we'll present a comprehensive guide to leukocyte-poor platelet-rich plasma preparation using the NeutroFree PRP system. This double-spin method ensures high platelet recovery while minimizing leukocytes. In regenerative medicine, the quality of platelet-rich plasma can determine whether you're merely treating symptoms or actively accelerating healing. The NeutroFree PRP system was developed to solve key limitations found in commercial kits and vacutainer-based protocols. This isn't just another PRP method, it's a fully closed, precision-controlled system designed to generate high-concentration, leukocyte-poor PRP with minimal neutrophil contamination. By processing large volumes of whole blood and leveraging a dual-spin protocol, NeutroFree doesn't just isolate platelets, it refines their recovery. And unlike most kits, it accesses the buffy coat after the second spin, which is crucial for effective neutrophil depletion. The result? PRP that's not just concentrated, but optimized for anti-inflammatory outcomes, ideal for intra-articular injections. The system's performance is anchored in calibrated physics. The centrifugation protocol delivers a consistent platelet concentration factor of over 7 times baseline, and crucially, with minimal loss during processing. But this isn't just about quantity. By removing over 99% of red blood cells and granulocytes and reducing all leukocyte subtypes by over 98%, the NeutroFree protocol ensures that what remains is almost purely therapeutic. That purity directly translates to a lower inflammatory profile, a key benefit for orthopedic applications, especially in joints where inflammation impairs healing. While vacutainers are widespread in lab diagnostics, they're poorly suited for platelet-rich plasma preparation, especially when purity and yield matter. One concern is that these devices aren't Class 3 medical grade, meaning they may carry residual endotoxins, unacceptable when injecting into patients. Needle-based plasma extraction slows down the process and makes precise platelet selection nearly impossible. And because most systems use fixed-angle centrifuges, the buffy coat shifts, reducing platelet yield and neutrophil separation efficiency. Critically, there's no effective way to reduce leukocyte content using vacutainer tubes. That means you're often injecting PRP with a pro-inflammatory profile, especially in joint applications. And because vacutainer workflows aren't truly closed, they involve multiple handling steps and can only process small blood volumes, which limits the quality and consistency of the final PRP. One of the key strengths of the NeutroFree PRP system is that it's built entirely from commercially available, single-use medical components. There's no need for proprietary cartridges or device-specific consumables. The core setup includes 60 milliliter Luer lock syringes for whole blood collection, butterfly scalp needles, ideally 21 gauge to reduce hemolysis, and Luer lock transfer connectors to maintain a closed loop throughout processing. What you see here is the full array laid out, ready for PRP preparation. It's accessible, affordable, and repeatable by a single operator. If not needing to collect samples at each stage of the preparation, the entire material list shrinks significantly. A key reason the NeutroFree PRP system achieves such high-quality leukocyte-poor PRP is its use of variable angle centrifugation. Unlike fixed-angle rotors that tilt separation layers and shear cells, swinging bucket systems allow the contents to settle in perfectly horizontal planes. This means more precise layering of plasma, buffy coat, and red blood cells, and a gentler, more consistent recovery of platelets. The result is optimized separation with minimal cellular trauma, one of the core reasons this system outperforms fixed-angle alternatives in platelet recovery and purity. One of the most practical innovations of the NeutroFree system is how it adapts standard syringes for centrifugation. No need for vacutainers, just 2 simple modifications transform the syringes into precise separation vessels. The first is plunger stem modification. We remove part of the actuator stem, the long plastic shaft that normally protrudes from the back, otherwise impeding the syringe from fitting into a centrifuge bucket, leaving just the internal rubber stopper inside the barrel. This creates a flat, stable base for spinning without interfering with the centrifuge's balance. The second is a quick barrel flange reduction. By trimming the outer lip of the syringe barrel, we ensure a proper fit inside the swing-out buckets. Importantly, these modifications do not compromise sterility, safety, or medical efficacy. The syringe remains sealed and fully functional for processing. This lets you maintain a closed-loop system from start to finish, without relying on expensive and difficult-to-acquire custom-made consumables. Leukocyte-poor PRP is defined by what it leaves out, specifically the white blood cells that drive inflammation. By significantly reducing leukocyte content, we reduce the risk of injecting pro-inflammatory cytokines like IL-1 and TNF-alpha, which are known to accelerate cartilage breakdown in joints. This makes leukocyte-poor PRP ideal for intra-articular use. It's not just about delivering platelets, it's about minimizing inflammatory interference and creating the conditions for actual tissue repair. That anti-inflammatory profile protects cartilage, supports a cleaner healing response, and makes the treatment safer for repeated use. The NeutroFree PRP system uses a double spin method specifically designed to produce leukocyte-poor PRP. We access the buffy coat only after the second spin, allowing for greater control over neutrophil reduction and platelet recovery yield. The process includes 4 core steps: blood collection, a first high-speed centrifugation to concentrate the buffy coat layer and select the desired final PRP plasma volume, followed by carefully transferring the buffy coat, and a second, gentler spin to concentrate the platelets into a usable volume of leukocyte-poor PRP. We begin by collecting 54 milliliters of whole blood, 27 milliliters into each of 2 60 milliliter syringes, each preloaded with 3 milliliters of ACDA anticoagulant. This 1:9 ratio is ideal for platelet support during centrifugation and injection. The first spin is performed at 1,250 RCF for 20 minutes. This spin separates the whole blood into 3 visible layers: platelet-poor plasma at the top, the buffy coat at the plasma RBC interface, and erythrocytes at the bottom. After the spin, we carefully aspirate the top layer of platelet-poor plasma, stopping just above the buffy coat, to retain as many platelets as possible for the second spin. Next, we identify the buffy coat, the white cloud-like interface between the plasma and red cells. We then aspirate the remaining platelet-poor plasma, along with the buffy coat and a small volume of red blood cells. Note that the volume of platelet-poor plasma remaining above the buffy coat determines the final volume of PRP recovered after the second spin. This mixture is transferred to a new sterile syringe. The presence of a small amount of RBCs is intentional, as it helps bring along the dense platelets that settle just beneath the buffy coat. The second spin is designed to concentrate platelets without forming a dense platelet pellet, which can inadvertently mechanically activate them. We spin at 380 RCF for 5 minutes. This gravity and spin time is ideal for concentrating the platelets into the supernatant plasma. After the spin, we carefully aspirate 5 milliliters of golden, highly concentrated leukocyte-poor PRP from the top. It's critical to avoid drawing from the RBC layer beneath, which now contains most of the neutrophils and residual granulocytes. Here's a side-by-side view of the workflow. First, we see whole blood with ACDA. After the first spin, we see a sharp separation of plasma components. And finally, the PRP itself, rich in platelets, low in leukocytes, and visibly golden. Our system's performance is laboratory confirmed. In just 5 milliliters of prepared PRP, the NeutroFree system delivers a 7 times platelet concentration factor. That's over 4.4 billion platelets, enough for effective regenerative therapy. What's more impressive is the platelet recovery rate. 56% of all platelets from the original whole blood volume are retained. That level of recovery is rare, especially in a system that's also designed to exclude leukocytes. Here's how effectively unwanted cells are removed. Red blood cells, 99.93% eliminated. Granulocytes, the most inflammatory white blood cells, reduced by over 99%. Total leukocytes dropped by 95%, with over 97% of monocytes and 91% of lymphocytes also removed. This side-by-side table shows the transformation from baseline whole blood to PRP and platelet-poor plasma. Red blood cells dropped from 3.67 trillion per liter in whole blood to just 0.03 in the final PRP and are completely absent in the PPP. Platelets increase dramatically, from 130 to 887 billion per liter in the PRP. And in the platelet-poor plasma, you'll notice platelet levels fall to just 13. That confirms effective concentration of the platelet mass into the buffy coat during the first spin and successful recovery of that mass in the final product. These results are based on laboratory hemogram readouts. They confirm that NeutroFree PRP not only concentrates platelets, but isolates them with high precision and minimal contamination. Here you can clearly see the difference between PRP and platelet-poor plasma. Platelet-rich plasma has a deeper golden hue due to the high concentration of platelets and growth factors, typically 5 to 7 times baseline levels. The syringe on the left contains what's left behind, platelet-poor plasma. In contrast, platelet-poor plasma is clear, paler and more straw-colored, reflecting its near absence of platelets. But here's the important detail, that platelet-pure plasma wasn't from a separate prep. It was produced by taking the remnants from the second spin, the RBCs and buffy coat layer, after the PRP was already aspirated, homogenizing and spinning them again under the exact same conditions. The fact that it yielded clear platelet-poor plasma confirms that virtually all platelets had already been recovered into the PRP syringe on the right. The inflammatory leukocytes can be seen firmly pressed into the buffy coat that remained. The color contrast offers a reliable visual confirmation of the system's platelet isolation efficiency. A common misconception in PRP therapy is that the platelet concentration factor, say 5 times or 7 times baseline, is the most important number. But in practice, it's not. What really matters is platelet recovery, the percentage of total available platelets you've captured and delivered. Because it's the absolute number of viable platelets, not their concentration per microliter, that drives therapeutic effect. Here's the critical insight. Concentration factor is a variable. You can manipulate it simply by reducing the final volume. The same 4.4 billion platelets, if concentrated into 5 milliliters, gives you 1 concentration factor. If you reduce that to 2 milliliters, the concentration doubles, but the platelet dose stays exactly the same. So while high concentration factors may sound impressive, they can be misleading unless you also know the platelet quantity. Therapeutic efficacy comes from dosage, not dilution, and that's where NeutroFree PRP shines. It gives you the flexibility to adjust the volume without compromising the therapeutic payload. The NeutroFree system was built not just for lab performance, but for clinical practicality. Each preparation costs about $16 or about $3.61 per billion platelets, making it one of the most affordable high-yield PRP systems available. By eliminating needle aspiration and relying on controlled syringe plunger movement, it ensures precise, reproducible platelet collection, reducing operator variability. And because it avoids the formation of platelet pellets, it helps protect platelets from mechanical activation, preserving their therapeutic potential exactly when and where you need it. The NeutroFree system doesn't just stop at PRP. It's built for the future of regenerative medicine, with seamless adaptability for advanced plasma protein therapies. Using standard Luer-Lock hemoconcentrators, you can process IRAP and A2M plasma proteins, interleukin-1 receptor antagonist, and alpha-2 macroglobulin, which are used to block inflammatory cytokine activity in joint environments by binding and neutralizing catabolic enzymes involved in cartilage breakdown. And because everything runs on universal Luer-Lock connections, you can integrate these advanced filtration steps without changing your workflow or hardware. This kind of adaptability turns NeutroFree from a single-use tool into a regenerative platform, ready for the therapies of today and tomorrow. To recap, the NeutroFree PRP system delivers what truly matters in regenerative therapy: a high-yield, leukocyte-poor PRP that's anti-inflammatory, cost-effective, and backed by data. Its dual-spin method ensures precision platelet isolation with minimal cell contamination. Hemogram analysis confirms over 56% recovery, near total leukocyte removal, and therapeutic platelet concentrations. All of that at a fraction of the cost of commercial kits, using components that are accessible, modifiable, and compatible with future plasma protein therapies. That's NeutroFree PRP, built for clinicians, optimized for results. Thanks for watching and for your interest in the NeutroFree PRP system. To dive deeper into preparation protocols, clinical applications, or component compatibility, visit us anytime at DIYPRP.com. If you have questions, our team is here to help. Reach out through our site. We're glad you're here, and we're excited to support your work.